clinician, but also a researcher. So as a researcher, I have dealt with basic research in cardiology, in particular what we would call cardiovascular protection, meaning with different approaches to try to protect the vascular system, the blood vessels, as well as in particular the heart, before and after heart attacks or in patients with heart failure. I came across a lot of people who are interested in the stem cell therapy, and I was approached by many people, orthopedic surgeons, plastic surgeons, gynecologists, who wanted to use our preclinical data in order to try to transfer those data into the clinical scenario for their patient, whether it's a patient with joint diseases, arthritis, whether it's for infertility, whether it's for other conditions which have to do with aging of the human body. In that context, I met Karen Mulholland Angeles, who is a fantastic businesswoman, and we became partners with regard to the idea to try to develop a forum where we can use regenerative therapy, including stem cells, to use these kind of therapies for patients who really don't have any other options. So we created a company which is called HeartStem, where we try to use stem cell therapy for patients with heart and vascular diseases. HeartStem is more focused on the cardiovascular system, on the heart, on the penis, on the lungs, on the great arteries. So in HeartStem, as an example, we use those treatments for patients with chronic heart diseases and other vascular conditions, and we follow them closely up over time in order not only to ensure safety of the patients, but also to follow their clinical course and also to use this data down the road scientifically so that we can share our results with our colleagues and co-researchers. We had several patients who were sent to us or came to us and asked us, is there anything we can do? And I remember at least 5 patients within the last year who were sent to orthopedic surgeons or podiatrists for amputations of toes, feet, or the whole leg, whom we injected with stem cells. In one particular case, in fact, the perfusion improved so much that the patient who was sitting in a wheelchair for years now walks, avoiding amputations of legs after using stem cells. Patients know about that. Patients read about this because all those data are over the web, even though it's not part of large-scale clinical trials. Even anecdotal data play a major role if it's you or me fearing losing a leg.